Thank you. Really interesting questions and quite a range there. Lots of different issues that I know Stephen and I both really kind of want to get our teeth into. So I'll try and go as quickly as I can. Um, so Ian sort of started off talking about schools. Um, Obviously, we still have huge risks around schools, and the CO2 monitors. In fact, I'll show you mine. Mine's showing a high number, but obviously I'm the only one in the room. I'm not going to catch anything from myself. Yeah. But I should probably open a window. CO2 itself has its own risks. It can make you drowsy, but on its own, it's fine. Um, so yeah, I mean, what can we do about schools? It's really difficult. We need to sort of raise awareness. We need schools. I've heard that schools are selling their CO2 monitors on eBay. It's awful. We've paid for these resources for schools to stay safe, and they're just, they're getting rid of them because schools are struggling financially. They're struggling to employ their staff. They're struggling to, that they have for years struggled to fund basic facilities such as, I don't know, it's glue sticks. Try and find a glue stick in a school. I promise you, you'll really struggle. It's really, really difficult. Schools are under a huge amount of pressure, and they've been told that they have to fund pay rises that they can't afford. So opening windows was a nice idea, but obviously it made children cold. People didn't like that. So HEPA filters do solve that problem to an extent, but we still do need fresh air for children because of the drowsiness, because their attention sort of decreases as they get drowsy. And if you've ever been, I'm a teacher myself, if you've ever been in the classroom at the end of the day, children get really tired, and it will have been because of CO2 and poor ventilation historically that and teachers have sort of starting to understand that. So I mean, I don't know, schools will have to work on lifts. Right, so it's very difficult. I mean, we do know there's evidence of infections, people catching infections in sort of larger spaces over a number of hours afterwards. I don't believe there's any studies on lifts. I would hope that there would be some degree of ventilation in lifts because of the high population density that you have inside them. But if you imagine someone, making the invisible invisible, as Stephen's saying, people breathing in the air. If you imagine the people in the lift of vaping in there, if you could see that air, you could see it hanging, then maybe you would think twice about going into that space. And so that's kind of how I would ask you to view it. But in terms of risk, it depends on whether the people are infected. It's hard to say. Right, so kind of moving on to Evershed. Well, I mean, it's probably a niche topic for some people. They won't know what it is. Basically, it's a treatment which is a pre-treatment for people who don't have any immunity to infection, and it can provide them the antibodies that people with normal immune systems could produce from vaccination. Obviously, over time, it's become a problem because our government dragged their heels and did not approve in time, and then they passed it on to lice, which then made the process even longer. And now we're at the point where it is not effective against the current variants. And so if we were to give people this treatment now and then they felt that they were protected, then you would be putting them into kind of high risk situations in that way as well. So it's really disappointing. We've lost a year of freedom there. But obviously we're hopeful about this new trial, but we won't know anything until a year's time, sort of how that's worked. And we do need to put pressure on the government to approve in a more rapid way, and not necessarily, I mean, it's been treated exceptionally. Every other medication and vaccine has gone through a much more fast-track process. NICE was not used as part of the approval. It reached MHRA. MHRA said it was safe and effective, and then it got stuck. So yeah, we need to not be treating Evershed exceptionally, or whatever the new treatment is that comes out. And there are other things in the pipeline. National Medicine Service, it's a great idea, but I mean, so it would involve money, it would involve investment. I mean, I don't know. I like the idea of it. It's certainly something that sort of occurred to me at different points. But obviously, owning that intellectual property, being able to sort of sell those treatments, the money coming back, it would be great. We have like really talented people working in the NHS who do research, we could use those skills, but again, it's whether there's a desire, and it seems that a lot of the time, the desire is more to sort of sell things off and privatize. So it doesn't seem to be the direction of travel right now. Masks are expensive. There is evidence that you can reuse, like single-use masks. I'll see if I can find links and pass them on later on. You can, and you can have a higher quality mask that you can reuse. I use Cambridge masks a lot of the time, which are FFP2 equivalent. They are reusable. They look more kind of like a fabric normal sort of looking mask to other people, so they might not react so badly to them, because sometimes people do react badly to masks, unfortunately. The pledge, yeah, I mean, I'd like to see sort of more in the way of kind of sort of substance in there. I know Stephen and I have spoken about it before. It's difficult. I mean, you need to get people on board. Okay, we really want to get people on board with the pledge. That's the first stepping stone, and then we build on it from there. So the more people, I mean, we're not really asking for much. We are asking for what they should already be doing. People should be isolating. People isolate for other illnesses. Your child has chickenpox, you shouldn't be sending them into school. Why is it that we are then saying that it's okay to not isolate? Why is it that we're saying that the length of time that people should isolate has been reduced to the point where people are infectious still and they're being sent back into the workplace? That is not safe. That's not fair. And it particularly discriminates against the vulnerable group who are higher risk, but it affects everyone, because that risk of long COVID, we don't know the long-term effects. We don't know. It seems to be cumulative. The more time people are infected, the more cases of long COVID we are seeing. So I just, it's really difficult. So Almuth was talking about school ventilation and her FOI, talking about the 1,500 parts per million, which actually for CO2 itself is too high a level. The guidance that the government gave out to all of the schools was 1,500 parts per million was, sort of their kind of line. But then if it exceeds 1,500, stay in the room. You don't, you can open the windows, maybe you can do something, but you don't need to act like particularly that, there's no sort of fire in the room. Don't worry about it. Just carry on with what you're doing. Teachers aren't sat there looking at CO2 monitors or less, and I can promise you that much. They've got 30 children in a room plus, and they're trying to manage, so they really can't be doing that. We need to take that out of their hands. We need to give them air filtration so that they don't have to monitor, and they can stay safe. So Hannah mentioned the House of Commons. It's not HEPA that they have in the House of Commons, and actually it predated COVID. The filtration system that they have in there. It's not. It's I can't remember what it was, but it's something different. It does clean the air. It was the Department of Defence did add something post the pandemic, and they have been cleaning their air. So there is definitely, they do understand. They are making decisions based on that, and they are protecting their workers, although they're not protecting all of us. Sally had lots of amazing points. Hybrid working, yeah. Why is it that people are being forced back into the office for no particular reason? We are seeing people who are getting pressured to return, even though they can do their job completely away from the office. Hate crimes, yes. I mean, we see it in our group. It's awful, and yes, we have become another equalities group that is very specific. It's been caused by the pandemic. It did not exist before in the same way. I mean, it probably did exist before, but not in the same way, not to this extent. You wear a mask, you become a target. People can see you, but to be honest, a lot of people aren't necessarily going out there that much. Their lives have become, part lives. They can't live the same life that they had before. And so, we do need to think about inclusion. We do need to think about how is it we're going to improve people's lives. And clean air is such an important part of that, because it doesn't just help us, it helps everyone. It reduces infections, all types of infections. It reduces all of these impacts, in terms of asthma, pollution, we can do something to improve it. We should be demanding clean air is our human right. Now, why is it that just because we can't see it, just because it's invisible, why is it that we don't think about the air? And it's become something that we really need to be fighting for. So Colin was talking about clean air and how that it should be obviously it's a political issue and problems with personal responsibility. And certainly for us, when you put personal responsibility onto people with the greatest risk, they have to carry the greatest burden. It is not fair. It's not inclusive. It's not something that we should be encouraging. And it should be social responsibility. It should be public health, and we should be supporting that. And I don't know what's happened to public health. It seems that COVID is no longer sort of on the agenda right now. It's disappeared. Nobody wants to talk about it. Look at the government; they don't want to discuss it. It's really difficult. It's in the past. We're using past tense words talking about a current pandemic. Yeah, it's hard. So about government departments working together, I don't know. I wish I knew. I'm talking to as many of them as I can, trying to get it onto their radar. But it's difficult because it's all about sort of money and funding and whether or not they think it's important. And if you swept it under the carpet, then they can find money free to help out, but they can't find money for this, it seems. Ian was talking about risk assessments and CO2s. We would like to see sort of more risk assessments. It seems that even for the people who are high risk, it's quite difficult for employers to sort of understand what they should be doing and how they should be managing those risks. And forcing people back into unsafe workplaces is unacceptable. Forcing children into unsafe schools is unacceptable. And then healthcare as well. Why is it that healthcare is not safe for us? Why is it that we take an additional risk when we go for urgent care that we have no choice about accessing? It's very hard. Bryce, MHRV, please, let's get that ventilation and into people's houses. It doesn't seem like it's any more expensive than a standard boiler, so let's do that. Let's encourage our local councils to do that as well. Marie, cost of living, it's huge, and it really, particularly our group, we feel it. We feel it because we were already struggling. We already have additional costs. We already have burdens that we're having to manage, and so adding on those additional costs of lateral flows or masks or whatever, our employers are not offering them to us as part of reasonable adjustments. Maybe they should. And